Minority AIDS Council for organizing this very important session this evening, including all of the staff. And let me just thank the panelists for participating today in this important discussion, but more importantly for your lives, living a life of service and one that really understands that we have to stamp this pandemic from the face of the earth. And so I just want to thank all of you and salute all of you for your work each and every day. Give our panelists. And also, of course, to Dr. Fenton with the Center for Disease Control and Prevention. Thank you very much. This is quite a defining moment, I think, with the new CDC numbers coming out. Unfortunately, we are learning what many of us knew all along, but at least now you know that for sure. And let me just say that this session could not be more timely given the numbers from the CDC and this very powerful report left behind from the Black AIDS Institute. So as a delegate at each of the last 5 international AIDS conferences, including this one, I have long spoken about the need to integrate United States HIV AIDS, the U.S. HIV AIDS epidemic, into discussions about the global AIDS pandemic. And I'm so proud of my home city of Oakland, California, led by a great man, a great warrior, Mayor Ron Dellums, who has taken the lead in the United States to make sure that the domestic epidemic is front and center in all of the discussions, not only in our county, in Alameda County, where we had to declare a state of emergency in 1999 as it relates to the African American community, but also much of what is taking place throughout the country. You know, Mayor Dellums has really led on our testing initiative, on much of what the recommendations which the Black AIDS Institute has presented. Marsha's here somewhere, I know tonight, and I just want to thank you, where's Marsha, for your leadership and for making sure that at least Oakland, my home city, is out front and leading this whole U.S. effort. And so at the last conference in Toronto in 2006, we saw the first major discussion of HIV and AIDS among the African American community. And I was so pleased then to see Julian Bond in Toronto, along with my colleagues, Congresswoman Maxine Waters, Congresswoman Donna Christensen, and other African American leaders. We actually signed the pledge saying we were determined that we were going to move forward with an action plan. Many in my district in the Bay Area continue to come since Durban to these very important conferences, because it's important that our community, that Americans connect with the world community on this pandemic, because it is global. It is a pandemic that's disproportionately affecting sub-Saharan Africa and the Caribbean, as well as the African American community in America. And so this is really a defining moment, and I think now we have gone one step forward at this conference in Mexico City. This very thought-provoking and groundbreaking report from the Black AIDS Institute, Left Behind, really has for the first time equated the epidemic in Black America in terms of the international, in terms that the international community can really understand. And I have to just thank Phil and all of the staff for your diligence and for your work, because you told us so. You told us so. And even before the CDC released its revised estimates, Black America ranked 16th in the world in the number of people living with HIV. I don't know if the analysis has been done yet, but I wouldn't be surprised now if we rank higher. So Dr. Fenton will discuss these numbers, and let me just say how disturbed I was to read that the estimate of the new annual infections had risen by over 40%. I was concerned especially by the estimate that 45% of infections were among African Americans and 53% were among men having sex with men. I was concerned and disturbed, but I wasn't surprised, because once again, we knew that there was an undercount for many, many years. And I have to say again, the Black AIDS Institute and others knew that from day one.